welcome back to the Oral Health Podcast. So because today is World Bipolar Day, and there are a few different links between bipolar and oral health conditions, we're going to have a little bit of a chat about it, but I will put a lot more information about bipolar and the studies that we're referencing in the description of the podcast. Karen is here with me, as always. How are you doing, Karen?
Good morning. Yes, I'm very well, thank you. You?
Yeah, good. The sun's out, which is just lovely and very
Spring
rare.
is here.
So bipolar, if you're not aware, it's a mood disorder. So generally characterised by large highs and large lows, whether that is over a long period of time or more frequent changes in mood. But hypermania and depression periods, flipping between the two fairly often for a long period of time, is how it's categorised and diagnosed. Now, different things come with it, so you can have a higher risk of things like bruxism and dry mouth rates, because a lot of the medications used to treat bipolar conditions are known for causing dry mouth. So I guess the first thing I wanted to ask you, Karen, is if your medication is going to cause dry mouth and it's not possible to request a different one, because quite often the one that you're put on is the only one that works. So what can you do yourself to try and combat that? Just being a little bit more aware that it's going to happen.
Yeah, I mean, there are the hundreds of different medications for lots of different complaints that cause dry mouth. It is a really, really common problem. And if you do notice that your mouth is drier than normal, that you're kind of feeling a little bit, where your tongue feels like it's not moving as well as it could do, and you feel like you need more lubrication, it's probably a side effect of the drugs that you're taking to keep your bipolar under control.
Like well managed, yeah.
Yeah, so obviously you can't stop taking your medication, so we need to make adjustments to make your mouth more comfortable. Now, there are things available over the counter, so speak to your dentist, speak to your pharmacist. Lots and lots of different preparations, so you can do it in lots of different ways. So some people prefer a gel when they wake up in the morning, because it's particularly bad in the morning, because our natural saliva flow reduces by about 50% overnight anyway when you're asleep. So if you already are coming from a low saliva point, then it's going to be even worse. So your mouth will be quite uncomfortable when you wake up. So as I say, some people like a gel in the morning. There is a toothpaste that you can brush your teeth with that encourages the saliva flow. There are mouthwashes, lots of different things. So you might need to use sort of a couple of them at different times in the day. So, for example, if you're out during the day, you may want to pop a bit of the dry mouth chewing gum in your mouth, which makes your mouth moister and more comfortable. They do like little tablets that you can suck as well, which will produce more. So just finding what works for you and kind of almost making a little diary of when your mouth feels worse. And it's probably, if you're out socialising and you're talking quite a lot, that will dry your mouth out. So you might want to have something that's quite discreet that, you can just pop in your mouth and your mouth will feel more comfortable. Saliva is very, very important for oral health. It neutralises the plaque acids that are produced when we have anything with sugar, or can be broken down into sugar. So people with a dry mouth are more susceptible to dental decay. So it's important to remember. So when you speak to your dentist, obviously they will ask you for a full medical history and the tablets that you're taking, etc. Mention to the dentist that you are having a dry mouth, and they may want to put you on a high fluoride toothpaste to try and combat the lack of saliva and make your teeth as strong as they possibly can be.
Yeah, definitely. And I know it might not feel relevant to declare stuff like mental health conditions when a dentist's asking for medical history, because I know I've been there and thought, well, that's got absolutely nothing to do with my teeth, so why on earth am I going to declare that? But actually now knowing a little bit more about how it's linked to everything, it's always relevant And you could even just put, I'm on medication that has a dry mouth listed as a symptom.
Yeah.
If you don't want to go into the nuts and bolts of your mental health condition, is that fair to say?
It is, but I mean, I think every mental health condition, every condition that we could possibly be, have sort of a systemic condition, wherever, it does have a bearing on your teeth, and it has a slightly different bearing to, as we said before, certainly people with bipolar do tend to clench and grind their teeth more. So more than people that are perhaps have another mental health condition. So it is important, because if you say to the dentist, I have bipolar, they will know what to look for. So they're looking for unnatural wear on your teeth, basically. So if you are clenching and grinding your teeth, some of the signs that the dentist would see would be flattening cusps. So if you imagine your molar tooth has got 4 corners, so you've got 4 sticky up bits. If you are grinding your teeth, they won't have points anymore. They will keep getting flatter and flatter. So the dentist can see the wear patterns there. Also, you may find that you break teeth more often than is for an average person. So you may be going to the dentist and saying, oh, this piece of tooth has come off, or this filling's come out, and it could be because you're clenching or grinding. So you're putting your teeth under more pressure than they would be normally. So there are things that can be done for that as well. So the dentist can make you a night guard to wear, so that it will stop. Some of them stop the grinding, some of them allow you to grind but protect the teeth. So it might be a bit of a juggling act trying to find which one is right for you. And it could even be a referral to a maxillofacial specialist to have a look at the way that your jaws are coming together when you're actually grinding. And, grinding doesn't just affect your teeth. You will get facial pain, headaches. It can even be backache and into your shoulders, because you will hold yourself differently. So when you I have a dry mouth. When you get up in the morning, especially because you grind at night because you don't know you're doing it. So you can either ask a partner, because they will hear it, because it is, if you've ever slept,
nice sound.
It's like somebody running their nails down a blackboard. It's really horrible. Yes. So when you wake up in the morning, you may find that you've been prodded half the night, but also where you'll feel tenderness around where the ear opens. If you put your finger just in front of the ear opening and open and close your mouth, you will feel the actual jaw joint moving. So that's your temporomandibular joint. And if there's pain there, you pretty much know that you are grinding. And the muscles in your face as well will be tender, so going up, as I say, into a sort of a tension headache. But like I say, look at your posture as well, because sometimes if you are grinding, it can have a knock-on effect to the whole of the rest of your body not being held straight. So grinding on the surface of it might look like it's just an annoying thing to do, but there are other sort of knock-ons that have. So if you do find you're doing that, I think it's really important that you have a chat with your dentist. Don't buy something online, because it's not made for your mouth. It could do more harm than good. So as I say, may even be a referral to a specialist, which will help you to minimise the damage and minimise the pain, because it can be quite painful.
Yeah, definitely.
Yeah.
And I know more anecdotally than what I've sort of read, for me, I know I bite the inside of my mouth a lot, and bite my tongue when I'm like, rather than grind my teeth. That's kind of my
cheek
thing.
Biting is very, very common, and it's another thing that your dentist will see immediately you open your mouth, because you almost have a callus stripe along the inside of your cheek. So if you're doing it and you have a look inside, you'll see a white line.
You can feel it as well when you push your tongue along it.
And I think there's always times that we're going to be more pressured than others and feel more tense, and everybody has an outlet, really. I mean, some people bite their nails, some people chew their cheeks, some people grind their teeth, some people do all sorts of very things that will bring them down. And if you can learn those kind of pressure releases, that's probably something that your doctor would want to do, be able to help you with, trying to manage your condition.
Society kind of talk about how mental health shows up in lots of other areas of the body, like anxiety and the stomach have quite an interesting link, because your stomach gets tense and the butterflies, quote unquote, and blah blah blah. But actually, your mouth shows a lot of signs that get overlooked initially.
It does, but your dentist can see a lot of things by your mouth, and the more information you can give your dentist about your medical history and the things that happen for you, the better position they are to help you. They're not there to judge you. They're not there to go, oh, have a look, what's on this medical history.
What's going on? No, they don't care.
No, they are there to, do the best for you. So the more information that you can give them, and the more background on what you actually find that you're doing. But dry mouth is quite a funny one, really, because when you're at the dentist and they put lots of things in your mouth, you produce more saliva. So your mouth tends to not look as dry as it normally is. So it can be masked sometimes. So it is important to just say to your dentist, do you get a bit of dry mouth? What would you suggest? As I say, or your pharmacist will be able to do it. They're all available over the counter. They're not. They don't tend to be prescription only if you're looking at
like really heavy duty stuff.
Yeah, full replacement saliva, which you'd probably only need if you'd had head and neck radiotherapy. So we're not in the realms of that. So you probably over the counter would be absolutely fine.
And just to bring it up to a close, there's lots of things that we are not able to talk about because it's not in our realm of expertise, and I am going to put more information in the description of the podcast if you want to go and have a read of it. And if you've got any coping mechanisms that you use to help stop grinding or help get rid of dry mouth, then feel free to share them, because often coming from another person, it sounds better than coming from a dentist or like someone like ourselves.
We can only go on sort of anecdotal things and things that we've picked up over the years of working in dentistry. So we're by no means experts on mental health or any of these conditions. So we can just say what we can notice from seeing patients that perhaps have bipolar, but that's not something that we are experts on. So we just know we're just teeth. Teeth and mouths.
So yes, I'll link all of that in the description. When we talk about mental health more generally, we can talk a little bit more about this. I'm sure in the future we'll touch on it again, but further readings there if you want it, and if not, we'll be back next time with a slightly more cheerful topic.
Well, it is spring.
It is spring. Never know.